Picture this. It is a Saturday afternoon, and you are finally clearing out the garage. You are alone, the radio is on, and you are using a utility knife to break down a stack of cardboard boxes. You are kneeling. The blade catches on a strip of packing tape. You pull harder, and the knife skips free and buries itself in your inner thigh, high up, near the crease of your hip. It does not hurt as much as you would expect. You look down, mildly annoyed, and then you see the blood, and it is not seeping. It is coming out in rhythm, in time with your own heartbeat, and some distant part of your brain understands that this is not a bandage situation. This is a countdown. Hello, I am Dr. Morbid, and this is a case file. Today we are examining exsanguination, which is the clinical term for bleeding to death. It is one of the oldest ways to die, one of the fastest, and this is the part I need you to remember, one of the most preventable. By the end of this video, you will know exactly what happens inside a body as it empties, and more usefully, you will know how to stop it. Let us begin. First, the medical setup. You are, at this moment, carrying roughly 5 liters of blood, about 7% of your body weight. Your circulatory system is a closed, pressurized loop, and your heart moves the entire 5 liters through that loop about once every minute. This is remarkably efficient, and in your current situation, a serious problem because the femoral artery you have just opened is one of the largest high-pressure vessels in the human body. It supplies your entire leg. When it is cut, blood does not leak out. It is pumped out actively by your own heart, which has no idea anything is wrong and is going to keep doing its job with tragic enthusiasm. A fully severed femoral artery can drain a fatal portion of your blood volume in as little as 3 to 5 minutes. Trauma doctors classify blood loss in 4 stages, and you, kneeling on your garage floor, are about to experience them in order. Stage 1. Compensation. You have lost up to 15% of your blood, roughly 750 milliliters, a little more than a wine bottle. Here is the unsettling part. You feel almost nothing. Your blood pressure is normal. Your pulse is barely elevated. This is because your body has a contingency plan for exactly this scenario, refined over a few 100,000 years of humans being ambushed by things with claws. Your nervous system releases adrenaline. The blood vessels in your skin and gut clamp down, squeezing blood inward toward the organs that matter most, your heart and your brain. Your body is, in effect, deciding which parts of you it can afford to lose, and it has decided your skin is negotiable. You notice your hands look pale. You feel a strange, cold alertness. You press your hand against your thigh, and the blood comes through your fingers anyway, because casual pressure does not stop arterial bleeding. It requires force. You do not know that yet. Stage 2. The body starts asking for help. You have now lost 15 to 30% of your volume, somewhere between 750 and 1500 milliliters. Your heart is beating faster, over 100 beats per minute, because it has less blood to work with and is compensating with speed. Your breathing quickens, and now comes one of the most reliable and least known symptoms of serious hemorrhage: thirst. Sudden, overwhelming thirst. As your blood volume drops, your body pulls fluid out of your tissues to refill the pipes, and your brain interprets that fluid shift as dehydration. Your body is responding to a catastrophic plumbing failure by suggesting a glass of water, which is a sincere effort, but not a useful one. Your skin is now pale and cool and damp, because the vessels supplying it have shut down almost entirely. You feel anxious, deeply and specifically anxious, a sensation trauma patients describe as a feeling of impending doom. This is not psychological weakness. It is your brainstem detecting falling oxygen delivery and sounding the only alarm it has. You reach for your phone. Your hands are shaking from the adrenaline. Pay attention to this stage because this is the last stage where you are fully capable of saving yourself. Stage 3. Decompensation. 30 to 40% lost, up to 2 liters, nearly half your blood on the concrete. Until now, your blood pressure has held surprisingly steady, and this is one of the great deceptions of hemorrhage. The body defends its blood pressure fiercely, right up until the moment it cannot. That moment is now. The compensation fails all at once, and your pressure falls off a cliff. The effects arrive in quick succession. Your vision narrows at the edges, tunneling. because the retina is exquisitely sensitive to blood flow and is among the first tissues to lose it. There is a rushing, ringing sound in your ears. You feel a desperate hunger for air, breathing fast and deep, though your lungs are working perfectly. The problem is not oxygen getting into the blood. The problem is that there is not enough blood left to carry it anywhere. And now your thinking changes. Confusion sets in. Trauma surgeons will tell you that a bleeding patient who becomes confused or strangely calm or combative is a patient in serious trouble because the brain is now on the losing end of the body's triage. You look at your phone and the numbers on the screen have stopped meaning anything. You had a plan a moment ago. You cannot remember what it was. Stage 4. The point of no return. Beyond 40% lost. More than 2 liters gone. Your heart is racing at over 140 beats per minute, but each beat moves almost nothing. A pump cycling on a nearly empty tank. Your blood pressure can no longer keep blood moving upward into your brain, and your brain responds the only way it can. It shuts down. You feel heavy and cold and profoundly tired, and the fear from stage 2 is gone now, replaced by a gray indifference, which is not peace. It is oxygen starvation. You slide down against the boxes. The radio is still playing. Consciousness goes out, not like a switch, but like a dimmer. And once you are unconscious, without intervention, your heart has only minutes of work left in it before it beats against empty vessels, quivers, and stops. And this is the point where, medically, the story ends for you. You are watching this video, which means your blood is where it belongs. So let us pull back from the garage floor and talk about someone this actually happened to, because it did happen in daylight on a crowded street in front of cameras. April 15th, 2013, Boston. A 27-year-old man named Jeff Bauman is standing near the finish line of the Boston Marathon, holding a sign, waiting to cheer for his girlfriend Erin, who is running her first marathon. A few feet away from him, a backpack has been left on the ground. When the bomb inside it detonates, Jeff is one of the closest people to it. The blast destroys both of his legs below the knee. In an instant, he is living the exact case file we just walked through, except worse because he has multiple major vessels open at once, and his timeline is not 5 minutes. It is shorter. By every statistical expectation, Jeff Bauman should have died on that sidewalk. He did not. And the reason he did not was a man in a cowboy hat. Carlos Arredondo was a spectator that day, there to honor his son Alexander, a Marine killed in Iraq. When the bomb went off, Carlos ran toward it. He reached Jeff, saw the bleeding, and did the single most important thing a human being can do for another human being who is bleeding out. He stopped the blood from leaving. He used his hands and improvised tourniquets, clamped down on the wounds, got Jeff into a wheelchair, and physically held the bleeding closed while running him toward medical help. There is a photograph of this moment, and it became one of the defining images of that day. Jeff arrived at Boston Medical Center having lost an enormous portion of his blood volume at the very edge of what a human body survives. Verify exact reported blood loss figures before publication. Surgeons saved his life. Days later, Jeff woke up in intensive care, unable to speak because of a breathing tube, and asked for a pen. He wrote that he had seen the bomber, had looked him directly in the face, and his description helped the FBI identify the men responsible. He went on to write a book, Marry Erin and Become a Father. What Jeff Bauman's case teaches is brutally simple. He did not survive because his injury was survivable. He survived because a bystander applied pressure within seconds instead of minutes. In hemorrhage, the intervention is not complicated. It is early. So let us talk about why this matters to you specifically. Traumatic injury is the leading cause of death for Americans under 45, and uncontrolled bleeding is the #1 cause of preventable death after trauma. Read that again. Not unpreventable, preventable. A person with a severed major artery can die in as little as 5 minutes, and average emergency response times are frequently longer than that, especially outside of cities, which means that in a serious bleeding emergency, the paramedics are not the first responders. You are. Whoever is standing there is. This is exactly why, after the Boston bombing and the work of trauma surgeons who studied it, the National Stop the Bleed campaign was launched in 2015, built on a simple premise that bleeding control should be as commonly known as CPR. The training takes about an hour. And one more thing, because I know what you were taught. You were probably told tourniquets are dangerous and cause people to lose limbs. That belief is decades out of date. Modern military and civilian trauma data shows that a properly applied tourniquet can safely stay in place for roughly 2 hours, and limb loss from tourniquet use is rare. Limb loss from bleeding to death, I should point out, is total. Which brings us to the warning signs card. 3 signs, 1 intervention, 1 number. Sign 1. Blood that spurts with a pulse, flows steadily without stopping, or soaks through clothing and keeps coming. That is a major vessel and it will not stop on its own. Sign 2. Skin that turns pale, cool, and clammy while the heart races. That is the body shutting down its outer layers to protect the brain. Compensation has begun. Sign 3. Confusion, unusual drowsiness, or intense sudden thirst in a bleeding person. That is the brain losing its blood supply, and it means the clock is nearly out. The intervention. Pressure. Not gentle pressure, hard, direct, uncomfortable pressure, both hands, all your weight, directly on the wound, and do not let go. If the wound is on a limb and the bleeding will not stop, apply a tourniquet 2 to 3 inches above the wound, tighten it until the bleeding stops, note the time, and do not loosen it. It is supposed to hurt. Pain is survivable. The number, 911 or your local emergency number, and say the words severe bleeding, because those words change what gets sent to you. And while you have your phone out, search Stop the Bleed and find a free course near you. If someone you know needs to see this, share it, because the entire lesson of this case file is that the person standing next to the wound is the one who decides how it ends. And if you want more case files just like this one, subscribe, because Dr. Morbid is just getting started. 5 liters. That is the entire margin between you and everyone you have ever loved still having you around. Your body will fight for every milliliter with a plan refined over millennia, but its plan only buys time. It does not close the wound. Hands close the wound. Preferably informed ones, preferably yours. This case file is closed.